what would be some of your thoughts around these macro trends that are shaping up over the course of your journey?
Nothing was there to aid us. Nothing means nothing. We used to just talk to the patient. And when you're talking to the patient, we used to make the diagnosis then and there itself. You have to put the patient back to what he was earlier. So it doesn't mean that there is an AI, so the AI will put the person back. No, it is not. But there is, we cannot discount the role of technology also, because if you don't move with the changing times, you'll be outdated.
Any views in your regular practice? What are the ways you have started leveraging technologies?
The more knowledge you have, this internet helps you. Suppose I'm a doctor. If I access the internet, it helps me. But if a layman accesses the internet, there is a whole lot of information. He doesn't know which is applicable to him. Then he goes on doing, understanding so many things and totally confused what to do.
Hello everyone. Welcome back to Evolve, talks about healthcare's digital evolution. I am Vikalp Sahni, your host, navigating this dynamic landscape of healthcare and technology. In this episode, I have privilege of speaking with Dr. John Ebnezar at his own Parimala Hospital. Dr. John is a distinguished orthopedic surgeon with more than 38 years of experience, honored with prestigious awards such as Padma Shri, Dr. B.C. Roy Award, Karnataka Rajyotsava Award, Kempegowda Award, and the list just goes on, of nearly 300 such national and international accolades. Renowned for his contributions to academic, social, research, and community services, Dr. John holds 8 Guinness World Records for his exemplary work and has authored over 200 books, including numerous bestsellers in the orthopedic space. As a pioneer in his field, Dr. John has conducted extensive research and founded a new treatment method called holistic orthopaedics. He also established a new subspecialty in orthopedics, the geriatric orthopaedics. He continues to be an inspiration to the medical fraternity, and we consider it a privilege to have him with us for a deeper conversation on this episode of Evolve. Hello and welcome, Dr. John. It's such an honor sitting here in front of you. Thanks for giving us your valuable time.
Firstly, let me thank you and your team for taking this, making this effort of reaching out to me to have some inputs from my side. I'm really grateful to the work you people are doing, and I wish you all the best.
Thank you. It's a pleasure, sir. Thank you so much for your kind words. Sir, you are such an inspiring figure. Your journey definitely would be as inspiring as we would have read in many places. We would love to hear from you. How did it all started? You always wanted to be a doctor, and then from being a doctor into this noble service to becoming such a decorated doctor with Padma Shri Award, such a noteworthy accomplishment. How did it all happen, sir? A little bit of story of this would help.
Right. See, all this began years back, some 4 decades back, when I was in the school. And I was doing my primary education and middle education in convent, in St. Joseph's Convent in Gulbarga. There, my mother was a nursing tutor, and she was in government service. So wherever she was transferred, we used to go. So she was transferred to Gulbarga, so we went there. In the school, there was this habit by the teachers, they keep asking. They make you get up one by one and ask, what are you going to become? What are you going to become? They used to ask these questions. The same question was asked to me also. I said, I'm going to become a doctor. Then they said, why do you want to become a doctor? That is because at those times, we had only 2 professions. One is engineering and this doctor. I found the profession, medical profession, to be very glamorous, attractive, and society was respecting doctors a lot when compared to engineers. And then my own classmates, there were 2 or 3 who had big nursing homes and all. So I was inspired by that. more than that, it is my mother who inspired me. My mother was a nursing tutor. She was upright, honest, liked by all the students, and I used to accompany her in her classes, and I used to go rounds with her for the hospital rounds. Then I used to see the sick and the suffering people. I was attracted towards them. I felt that, we can make a difference in people's life. We can make them all right. They're suffering from disease, and we can put them back to the normal status. I think there was nothing nobler than that, I thought, because I saw so much of cries and sufferings in the hospital, and patients coming to the doctors with a lot of reverence and respect, and pinning the hopes on a doctor that they will treat the family member or whoever it is and give them a new lease of life. So that inspired me a lot. I said, if at all there is any profession which I should be following, I thought it is the medical profession. And then during one of the rounds with her, she took me around, to this orthopaedics department. So when I went there, I saw a plaster boy applying a plaster. And that white glistening plaster somehow, drew me. I was attracted towards that plaster. It was looking very nice. The way he was applying, and the broken limb, he has applied a plaster, and that was shining in the light. And I said, I think I should, become this guy. I mean, a surgeon, and become an orthopedic guy. So that was how it, got implanted in my mind that I should be a doctor and then go for orthopedics. That's what I, thought. And that's how my journey began. The attraction towards medical profession is primarily because of my mother. Then she said, see, if you can achieve even 1% of what Mother Teresa has achieved, or Ida Scudder, Dr. Ida Scudder, who found started Christian Medical College, Vellore. Yes. Even 1% of that work, if you can do, then I will be proud of you. And then it's worthwhile you pursuing medicine. But if you want to attract it towards the glamour, money, fame, name, just don't drop it, because you have got enough marks, you will get seat anywhere. In any stream you will get. So go to that stream, not to medicine. I went into medicine, and then never till today I have regretted my decision. Though there are friends of mine who have done extremely well in the engineering field or any other field. This profession I loved. I wanted to, pursue it. And my guiding principle was my mother's words, which still rings in my ears. As long as I'm contributing to the society, I think I have, achieved something in my life. I live for people, and I will die for people, and do the best thing. Even if I can change a bit of the medical practice, I would be happy, because we have been following so many, techniques, technologies and all. But if I can contribute something of my own, that is how this geriatric orthopedics, holistic orthopedics came into picture. This is something with innovation which I have contributed, and that has been accepted at the highest level. I feel that I have lived my mother's dream of becoming a doctor for the good of others. That's how the journey still goes on.
It's such a heartwarming, and for me it was goosebumpy when you were talking about how your mother took you through all of this.
And these awards and all you talk about, Padma Shri or whatever, it happens. See, It all depends on which path you choose. If you choose the right path in life, absolutely, and don't look at awards, but look at the your values, principles, ethics, goal, vision. Right. Awards do come. There is nothing. See, Padma Shri award is so rare. In Karnataka, there are only 17 Padma Awardee doctor awardees. Right. And the only orthopedic surgeon for the past 70 years to get a Padma Shri is me. Do I feel elated? No. I feel lucky. There are enough number of doctors doing extraordinary work, but they don't come into the limelight. My work was recognized, so I'm lucky, and that makes me humble.
So that's your humility.
Grounded. No, that is how it is to be. There is nothing, no credit of mine. It is all destined. And I felt that the path which I chose, my mother's, ultimately led me there.
Yeah.
Otherwise, I don't know. There are enough number of doctors, who are unknown today. They are, just pursuing their goals of, practice, which is not wrong about any stretch of imagination. What I say is not right. That is right for me, what I say. I would have got lost in that maze. complete, I would have gone, becoming then ultimately totally disillusioned. Now I feel happy when students come and tell, sir, we are inspired by you, sir. We took orthopedics because of you, sir. And you'll not believe 2-3 girl students who was now doing MS Ramaya Medical College, one girl called Sahana is doing her MS orthopedics. She came to me with her father here. She said, I want to become an orthopedic surgeon like you. You have inspired me. I said, why all for a female, why orthopedics? Pediatrics, OBG, medicine? No, sir, I am inspired. And everybody is telling me that I should not take up orthopedics because it is not a female-oriented branch. So I brought my father here. You advise me, sir, what I should do. Should I take orthopedics or not? I am heavily inspired by your speech. I had gone for the graduation ceremony in JJMNC, Davangere. Right. And she remembered it after even 10 years. Oh. Then I said, oh, you remember it? Yes, I remember every word. Father also, I was there with her. I also remember. So I come to ask your suggestion. I said, follow your heart. I did the same. I followed my heart. People said to me so many things to me. If you want to become orthopedic surgeon, you become. Yeah. Right? Don't go by this, a female cannot do. Female can do anything in this world. They have gone to the space. Right. Orthopedics is not a big deal at all. But you should love it. No, sir, I want to do it. And now she's doing a second year or so now. And another girl also came and told me. So inspiring students, that too female students, to take up orthopedics. They say, we have chosen career because of you. That is something which is more than any award you can give. Yeah. Because it is like one candle lighting another candle. Yeah. So I feel so blessed that I have touched people's life. However small it is, I have touched their lives. And what better award you can get than that? It's a satisfying journey, Vikalp, and I'm happy with my choice. And I love to be a doctor. And despite so many challenges what we are facing now, I don't regret my decision.
And your passion and your value system is actually infectious. And I totally agree with what you mentioned. Follow your heart. Yes. is the right thing to do. Yes. And then just respect the profession, do the service as much as it is. And I think that's what has taken you from being a child, looking at this glistering plaster, to now a Padma Shri awardee. And I mean, I can just keep on talking about your awards. So I think it's such an amazing story. And sir, this story is pretty long, and you have served so many years in this profession, looked at so many patients, spoken about medicines across. What do you think is changing over the course of these many, many years, this 35, 40 years of your experience? How the trends are shaping up? What are the big macro level changes that you have seen happening in medicine as a profession, orthopedics, because you work closely there, but in general, what would be some of your thoughts around these macro trends that are shaping up over the course of your journey?
See, the biggest change I have seen is information. There is so much of information available here. That is the biggest change I have seen in our field. Earlier, our approach was very narrow. Information was limited, and not much of technology was there. We were all conventional plasters. We were putting conventional plasters, doing conventional basic surgeries, right, like plating, nailing and all. And, do some physiotherapy, exercise therapy and all. So it was pretty straightforward approach. Right. There was no complicated, procedures involved. And we delivered then also. We delivered. It is not that we delivered, we were happy, patients were happy. Over a period of time, so many advancements have taken place. Right. The treatment has undergone a sea change. How we used to treat earlier, how we are treating now. So much of innovations have happened. So much of technology has come in. Right. And the implants have become sophisticated. From conventional implants, now we have come to custom-made implants. Right. For each person, we can design an implant for him. Now we have come with 3D pictures. We got 3D implants. So, we get very earlier was what we used to do was one implant which is generalized, and we use it for all. So it may be a miscalculated size. Especially we used to use implants from foreign countries, and they are bigger in size when compared to Indians. Indians are smaller built when compared to it. We used to use that kind of implants. Now things have changed. You will get the implant for you only now. This just like how you go and stitch a cloth.
Very personalized.
Yes, like how you go and It's like buying a ready-made cloth, or
Right.
you go and get a tailor, stitch it to your. So the orthopedics has grown to that level now, wherein you can have your own knee. When we put an implant in your knee joint, you can have your own implant which resembles your original knee. So to that extent, we have grown. I don't know if I start talking about technology. There is many things, not only just implants, the diagnosis, the diagnosis and the lab workup, what we do, MRI, CT scan, PET scans, you name it, we have it, DEXA scans. So many, laboratory technologies have come up which will help us make a diagnosis. When we were students, we relied more on clinical examination. We used to examine a patient.
Like
Right.
touch and feel and
we used to go
understand.
take history and take a pen and paper and a writing pad and go on writing down. And we used to start with the demography. What is your name? What is your age? What is the sex? What is the address? What's your this one? Like that we used to start, and then go like presenting history, then past history, then family history, personal history, all that. Then we used to come with examination, general physical examination, then local examination, then systemic examination. This is how we learned our trade. And nothing was there to aid us. Nothing means nothing.
Yeah.
We used to just talk to the patient. And when you're talking to the patient, we used to make the diagnosis then and there itself. We know that this patient has rheumatoid arthritis, or this patient has tuberculosis, or this patient has got neoplasia, tumors. We were so accurate in the diagnosis. And we always had the touch, feel, move with the patients. Right. And finally, the diagnostic help we had was an X-ray. No CT scan, no
MRI.
or X-ray.
Yeah.
And some basic lab tests. That's it. And that's how we passed our MBBS. And then we passed our PG. And then that's how we treated the patients with clinical examination. Even now, till date, I do clinical examination. So many patients come to me with MRI reports, CT scan reports. And the moment they come and sit here, they'll present the MRI first. So
Right.
I've got an MRI, please see it.
Right.
I say, first, let me see you.
Yes.
Right? You are the man who should, or the lady whom I should see,
Right.
not the films. They have got so much used to this that doctors want to see only the reports. So they present the reports first to me.
Yeah.
I said, keep it aside. First, let me see you. Let me examine you. Till today, I do my clinical examination. I'll give an example. A patient comes to me with backache, severe low backache. Sir, I've got this problem. I just do 2 screening tests. I ask the patient, bend forward, touch the ground. If the patient does that, and second test I will tell, lift your leg straight up to 90. If the patient does these 2 tests, I tell you are fine. Irrespective of the complaints you are telling me, you are fine. Right. You can just, forget about your problem and you can live your life. So then I explain to them. So, bending forward and touching the ground is a complex mechanics. It's a spine mechanics. If you can do that, that means your spine is in good shape. Right? That's it. And if you can raise your leg to 90, that means your sciatic nerve is free. There is no sciatica. That means your disc is not pressing on the nerve. Right. What does you require? Exercise, bed rest, some medication, temporary for a week or so. That should be enough.
But nothing to be deeply worried about.
Nothing deeply worried about. Patients need examination, ear to listen to them, and eyes to see, and hands to examine.
Yes.
This can beat the best of technologies.
Right.
Best, whatever you talk, AI, robotics, whatever you say, nothing can replace your eyes, ears, and your touch, right? And your brain. See, who created robotics? We created. Who created AI? We created. And how is that they are dominating us? How is that we are relying on AI to make a diagnosis?
Right.
When you make the diagnosis, then seek the help of AI.
Yeah. They can be a good aid.
They cannot replace a doctor.
Yes.
They cannot replace
They
a
can
doctor.
be a good aid.
They can be a very good aid. They can, all the cobwebs it will remove. And it will streamline your, if there is some human errors, that will be taken care of.
Absolutely.
And it will be a very good servant. All these AIs, these robotics are good servants.
Yes.
But we have allowed them to become masters. If they become the masters, then we will lose our way. This is my take.
Yeah.
I don't think they say that we have to adapt to change. Change is the essence of life. Bhagavad Gita also says that the only thing which is constant is change. So change has to happen.
Yeah, but
There is-
it should be more towards aiding rather
Yes.
than
Yes, what change you have to look in? Who is to decide what has to be chosen? The change, not all changes are good. There are some changes which are good. There are some changes which will not stand the test of time. In the pharmacy field, so many medicines we prescribed. There was a drug called Nemisolite.
Yeah.
They made us write Nemisolite. We wrote. Tons of medicines we wrote. Then after 4 or 5 years, they come and say that is hepatotoxic. It will cause liver cancer. And you made us write tons of medicine. And after 5 or 6 years, you're telling that it will cause liver cancer. This is how the technology is. Then they said about so many other ranitidine. Now they say ranitidine is dangerous. You should not give ranitidine. So this is the technology. What is good today may not be good tomorrow.
yeah.
Right.
And it's all ever evolving.
Ever evolving.
It's not something that can always be the thing.
Yes.
Yeah.
Yes. According to me, a good doctor is one who will treat a patient with minimum medicines, minimum interventions. There is something called our nature. There is the human body is the healer.
Yeah. And every body is very
Yes.
different.
Yes, everybody has the healing mechanism. If there is no healing mechanism internally, whatever you do as I put a plate and screw for a fracture. That's all I can do. The fracture has to unite by the nature.
Yes.
Nature has to come, bring the callus there, and then it will breach. I have to treat some diseases like say common cold or whatever. When I give a medicine, the immunity should work. If you just give medicine, if the nature doesn't support you, none of your treatment is going to be successful.
Yeah.
None of your treatment. So what? Should we discard change? No, we should not discard change. Because change is bound to happen whether you like it or not.
Yeah.
Whether you like it, you want it or not. Change is going to happen. Now, what choice is left to a doctor is how much of change you should use to benefit the patient. What is your ultimate goal? My ultimate goal is if a patient comes to me, I have to revert him back to the normal status. How you do it, whether it be the knowledge you do it, whether technology you use, something, it is up to you.
Right.
But you have to put the patient back to what he was earlier.
Yeah.
So it doesn't mean that there is an AI, so the AI will put the person back. No, it is not. But there is, we cannot discount the role of technology also.
Yeah.
Because if you don't move with the changing times, you will be outdated. We will be outdated. We have to upgrade our skills, upgrade our knowledge. But my take to all the youngsters is, be the master. Otherwise, it will become a Frankenstein-like thing, and it will devour you. It will become a monster unless you know how to put it down. Right. So this is my take.
Yeah, no, absolutely. And very well said. And I think the trend, as you mentioned, you spoke about information. There's an explosion of information since the time you would have started, and internet is one of that thing that has exploded this information even to the patients as well. And technology is aiding, technology is now overpowering as well in many cases. But sir, this information explosion would have also led, and you spoke a lot about the doctor profession, how the treatment should be happen, but to some extent, the explosion of information would have impacted patients as well. The myths and the misconceptions, I think a lot of patients would also come up with. Would love to hear your thoughts and what are your thinking around this whole misconception, myths, and that led you to the information explosion that has happened over the course of these many years.
I am very happy you came out with this question. So many patients have come to me. They have backache. They Google backache and it opens. So much of information. So many patients have done exercise seeing the YouTube. And one young patient who had come to me, he had an ordinary lifestyle backache. He was a software guy, so he had a lifestyle backache. I advised him simple rest and some medication for 3 to 5 days, and then hot fermentation, gentle massage. Okay, and avoid sitting on the ground, using the Indian toilets, and turn while getting up. Do these simple things and back stretches. That's all. He said, yes, sir. Then he took the prescription and went. After 4 or 5 days, I see him coming with a limp. He's not able to walk. He's coming like this. He was being slowly brought inside. He asked for a wheelchair. I was shocked. What, man? You were all right. Oh, I have given you simple instructions. Why you are coming like this? No, sir. After I went from here, somebody of my friend called and told, there are very nice videos available on the YouTube. You do that, you see that video, do exercise. So I went through that video, started doing exercise, and now I have become like this. I said, see, this is what happens if you follow certain things which you are not aware about. You think you are an intelligent guy, you can read, write, so you are a technical savvy person, so you can access any information you want. But when you say backache, there is so many things. Even cancer can cause backache. A gynae condition can cause backache, right? Then he is scared. Sir, the way I have become, I feel I've got cancer, sir. I said, how did this idea come to you? No, sir, I saw in the internet, they said cancer can cause backache. Cancer can cause backache means that does mean that you have got cancer. I said, what? See, we are sitting here, no, qualified. Why did you spend some 500, 600 rupees on us? We'll give you the advice. Why are you going and doing all this nonsense there? No, sir, this is what I feel I've got cancer, sir. I'm not able to walk only. See, what has happened to me? This is the misuse of information. We call this as Google Baba. These are Google Babas. The Google Baba, ironically, Vikal, the more knowledge you have, this internet helps you. Suppose I'm a doctor. If I access the internet, it helps me. But if a layman accesses the internet, there is a whole lot of information.
Absolutely.
He doesn't know which is applicable to him.
Yeah.
Then he goes on doing, understanding so many things and totally confused what to do.
No, which is true.
Which is true. So the information is good, provided you know how to access the information, how much to take
how
it,
much you can understand.
how much you can understand, how much there is a limit where to what you can read. You cannot go on reading. Then you will get mad. And then worst thing is you make self-diagnosis. You make self-diagnosis. You make self-treatment. And think that you are very smart. No. Information has to be taken with a pinch of salt and seek the professional help.
Right.
Ask, sir, do I have this problem? I'm there to help you. Or any doctor is there to help you. Lot of youngsters are misled by the information because they are not making the right use of the information. The information is not wrong. Information is right. But you don't know which to take.
Yeah.
So that is what my advice. So information is good, but be on guard. Don't take wrong information.
Yeah.
Take the right kind of information. And who is going to decide what is right, what is wrong? So you don't know what is right, what is wrong.
Yeah.
So the best thing, approach a doctor. And then if you want to know further, so I make a diagnosis for you. I say you have got disc prolapse. Let you Google and see what is disc prolapse.
Right.
But just don't see backache. Backache is the most common disease in the world, next only to headache. 80% of the world population suffer from backache. So if you just type backache, you will get the information which is voluminous. So if you specifically ask for something, the information helps you.
Check the fact.
Yes.
Don't infer.
Yes. Don't infer.
Like put your symptom and then getting inferences out of it is
Yes.
not right. While
Yes.
if there is a fact that you can check, you should do that. Or else,
Yes.
if you know about the profession, which is very well said, sir, like in our profession as well, because I'm a software engineer, I would be able to parse or process that information about software engineering far better from the internet
Yes.
than many others who might not know that information
Yes.
so deeply.
Instead of self-diagnosis, self-treatment, self-instructions, you go to a professional. Then if you need further information, access the net. Further information, doctor has told me I have got this problem. Okay, then access it. At least you can narrow down your search to the right kind of information instead
Absolutely.
of being vague like that.
So,
That's
very
what I
well.
feel.
Very well put, sir. And I think this is very important for all our viewers also to understand that this is the right way of approaching information.
Yes.
Because today we are living in the era of information explosion, and what AI is doing now is generating information, which is even more, so to say, useful in many contexts. But if it is not used in the right way, it can harm you as well. And sir, while this technology is evolving and it is touching almost every profession, and as you also mentioned, technology is to some extent important to aid the whole doctor profession, medicine profession, and a lot of technologies have come in. Any views in your regular practice? What are the ways you have started leveraging technologies? What are these things that you felt are important changes and right changes that has happened where technology has solved certain key problems, which is helping both doctors and patients and in general the community? Any specifics around that would
See, technologies have helped us to or minimize our errors
minimize errors.
in the diagnosis, minimize our errors in the investigation parts. And when we operate, when we use modern gadgets like say AI, enabled robotic surgeries, the precision has improved. The precision has improved. The recovery time is faster. The bleeding is less. The morbidity is less. Okay, and the accuracy has increased. Definitely, there is no doubt about it. The placement of screws in spine surgeries, the placement of screws has become zero error now. We are so perfect now in placing the screws, plates, all that. Earlier, it was all human. There were something called human frailty, human errors and all. Now that has been taken away by the technology. But the downside is the technology will know only what you have fed it to.
Yes.
See, you have fed some information about this patient. Only that much it knows. Anything which deviates from that, it will not be able to grasp. For example, I planned a surgery, right? And I feed everything. So this is the right knee, left knee, this, that, this size, walking, speed, walking, all that. So based on that, it will calculate what is the best implant for you, right? So it has aided you. Then you're using the robotic surgery. You are now precision perfect. You are doing the perfect surgery.
Right.
Right. So the AI is doing everything and you are very happy. Now, suddenly when something is happening, there is a fracture while placing the implant. Then this AI will not know what to do next. Because only what you have told, it knows. You are not told if there is a fracture, what should be done. Or if the power goes off, what should be done. If there is excessive bleeding, suddenly there may be some injury to a blood vessel while operating. The AI is a hand, the robotic hand. So it may just go and damage a nerve or it may damage a blood vessel. Blood starts oozing out. AI will not know what to do. Right. So AI, precision, everything fine. But it has its own problems. And if you look at the research literature, the success rate of AI-enabled robotic surgeries is 95%. That means still there is 5% chance of errors. And that 5% could be you. We never know. And conventional surgeries and robotic surgeries. The complication rate with a conventional knee replacement surgery is 2.5%. With AI, it is 1.5%. That means you have reduced your complication only by 1%.
Right.
That's all. That's all. It is not 100% foolproof.
Right.
And if you consider over a volume of cases, if I do without the help of robotic, I may end up with 2.5% complications. If I do with robotic, it may be 1.5%. So I reduce by 1%. Then you look at the flip side. So I'm not saving much on the complication here. What is the flip side? Long learning curve. To become a robotic surgeon, you will have to go and take training, which costs you a lot. And then you will have to develop the skill over a period of time. So it is not easy to straight away start a robotic surgery. The surgeon has to really put a lot of efforts. And what is the cost? Your cost jacks up. If I'm going to do a surgery with 1 lakh rupee, now it will cost you 2 lakh rupee. And then, this technology, the downside of technology being, the no empathy, no sympathy, nothing.
No, technology cannot work
Cannot
without
work. So when you come to me,
human.
sir, you say, sir, I got pain. Then I show some sympathy on you. I speak to you nicely. I touch your knee joint. I do all that. When you go and tell the robot that, I have got a knee pain. Oh, then you reel out facts. What is a knee pain, this pain, that pain. And you don't feel you are talking to a machine.
Yeah,
You're not talking to a human being.
That's not the way care should be provided.
When you're sick, when you go to a doctor, right, you want a human touch. You want a doctor to listen to you. You want a doctor to understand what you are suffering from. and you have to, he wants to empty everything to you. You'll not believe, so many patients come here, they have got some in-laws problem, that problem and all. They have nothing. They come with backaches. We are backaches, sir. You tell my husband that, I cannot walk. Huh? Then I call the husband inside. Then, sir, she's suffering a lot, sir. Please do something, sir. I said, then, okay, fine. You just sit outside. Then I asked her. Then she will tell the real truth. Sir, I have nothing. This fellow doesn't take care of me. I have to work from morning to evening.
Sure,
I have to cook food for the in-laws. They all keep grumbling on me. Now, I want to avoid work. That's why I'm telling you, I got backache. These things can happen only with a doctor.
Yeah,
Right?
yeah.
Yeah,
It's
yeah,
a very
yeah.
personal.
It will reel out, your backache with this, that. Do
Yeah.
this test, do this, like that. So a doctor is a doctor. A doctor can never be replaced. Even, whatever technology you bring.
Absolutely.
A doctor, but AI can aid the doctor. It can aid the doctor in bettering the service.
Absolutely.
That's it. That, other than that, I don't think, technology has got a great role to play. And another thing is infrastructure. Suppose if I want to do a robotic surgery, I cannot do it in my hospital here. I need a huge, setup like corporates. And even in government hospitals, we don't have robotics. So the reach of this technology will be very, very restricted, narrowed down to people who can afford it. And the infrastructure has to be that kind of infrastructure. And, it is not accessible to all. But still we get the job done with our conventional techniques. Right? In my hospital, I do conventional techniques and patients are happy. I have not had any complication. Then you go down to the tier 2, tier 3 cities, villages, where this AI is there. Where is your robotics there? Huh? And don't you think, they are not giving good health? They are all the grandfathers, grandmothers, they are strong. And this 20 years old, 30 years old guy, his son or grandson is suffering from all sorts of musculoskeletal problems. The man who is 80 years old, 70 years old walks down with a laugh. Where is the technology here? And you ask them what treatment you took. Nothing, sir. I don't take any painkillers. I just took this haldi or some this and I'm all right. So that means what? We are hyping this. We are offering this to patients. When it is not required, we offer it. Then 80% or now maybe some 60% of the people in the villages, they don't have access to AI. And they don't believe in AI. You tell them, we don't require all that. They will say, the moment you say, no, sir, no, knee replacement, our knees are gone bad. No, sir, I'm all right. You give me some tablets, that's all. That is the concept behind. Holistic orthopedics is nothing but whole body orthopedics. You are examining the patient, not just looking at the parts. And treat the patient whole, not just like a part. For example, if the patient has got knee arthritis, now what we do? We replace the knee. Forget that. The body has got 65 joints. If the knee has aged, then his other joints have aged too. Like shoulder, knee, hip, foot, the hand, everything has aged.
Yeah.
Then can you replace all the joints? You cannot. So why don't you look at the patient? There was one patient who had come to me. That lady was on a wheelchair. Then she came. I asked her, why are you in a wheelchair? Sir, knee replacement, I want to go. Knee replacement is done for you to jump and walk, not come on a wheelchair. No, sir. The doctor told, tomorrow you will walk.
Yeah.
Get the knee surgery done. I got the replacement done. Then, more than 3 months, sir, I am on the wheelchair. I said, why? Because I'm not able to get up only and walk. Why? Because she had a hip arthritis, which was not looked into. They straightened the knee, but there is a bent hip here. The moment she stands, she goes like that. She doesn't walk.
And that is our holistic.
Then simple holistic orthopedics, which treats the entire body. That is how the yoga also came into picture for me. I incorporated yoga into modern medicine, and that yielded rich dividends. Yoga was a concept which takes care of your physical needs, mental needs, emotional needs, which is the requirement for the day of the present time now. Right. So incorporating yoga, and I went into research. I did my PhD. We reached a lot of research I did on 6. Then I did a research on trauma. So that's in the world, it's the first of its kind, because yoga is known for hypertension, diabetes, asthma, like that. Not for fractures, spinal cord injuries and all. We did research on that, got 3 best research awards Then went to the research for knee arthritis, published papers. That papers was taken up by American Academy of Orthopedic Surgeons, AAO is what we call. They are the masters in the world who issue guidelines. They have issued guidelines on 100 diseases in orthopedics. Everything you go Google, you'll get the guideline. For example, backache, what should be the best practices? This is a guideline. Like that, 185 countries follow AAOS.
Yeah.
There my research was cited. Till today it is cited. Therefore, the knee pain, there are 11 techniques they have suggested, non-operative. In that, mine is number one, strong recommendation. Number one recommendation. What is it all about? Health education, self-management program, neuromuscular strengthening, and your mental and emotional well-being.
Wow.
This is recommendation number 1 out of 11. This is the top, right? And out of 11, only one mine, another is the paracetamol. Only 2 have got strong recommendation. All others are medium, weak recommendation. Strong recommendation means universally followed. Any patient can blindly follow that. It's a strong
without any
doubt.
Yeah.
And the doctor need not explain also. If he says this, do the self-management program, it is understood. There is nothing. But if I say, take this physiotherapy, then that can be questioned.
Yeah.
How the physiotherapy is going to help, what better alternatives you have got, like that. But when I say the recommendation number 1, strong, you do it, they have to just obey it. So that is the advantage of the guidelines, the recommendation, strong, all
recommendation
that.
by American.
All this happened, Vikal, over a period of time. It is not just like that.
Yeah.
Not just like that.
No, absolutely.
Not just like that. I got the idea of incorporating yoga, and not just yoga also. Yoga and modern medicine together, what we call integrated medicine. Yoga is 5,000 years old. Modern medicine is 200 years old. You have no belief in this 5,000-year-old history. You believe only this 200 years old, right? It is not discounting your technology. It is not discounting is. What we are trying to tell you is simple techniques, simple things added on to the modern medicine. You add yoga into robotics, right? How do you add? See, robotics give you a knee joint. You operate it. Put the patient on yoga to regain back the muscle strength.
Exactly.
See, the technique can put a knee joint there. I mean,
but then the strength,
muscle strength,
the
it cannot
healing.
give you.
Yeah.
It cannot give you. The balance, the coordination, the all that has to happen when you train the body.
Exactly.
That yoga can supplement. What's wrong? Your robotic plus yoga.
No, it's so true.
Right?
Absolutely.
Do it.
Absolutely.
I did, and now they accept me. You'll not believe. For the past 15 years, not a single back I've operated. Earlier I used to have discectomy, microdiscectomy, endodiscectomy, open disc, all a tuck, backache. Now, I never do. Even the most complicated back pain is vanished with holistic therapy.
Well, and Dr. John, this is so natural as well. Like today, if we do surgeries or after, let's say, any kind of issues as well, physiotherapy, and then after physiotherapy, exercises are being prescribed. And yoga could be a natural way for a body to heal as an exercise, as a supplement.
It is not replacing.
Exactly.
It is complementing. But people are scared that it will take over our traditional, our surgical practices. And then people will be rid of, the pain without, surgery. Then where are we end up? I am an orthopedic surgeon. My surgeon means I take it literally. My job is to only operate. We forget that we are orthopedic physicians too.
Yeah.
We are orthopaedicians.
And the core is to help the patient rather than doing only the surgeries.
You are a physician and surgeon both. See, you are a physician and surgeon both. But nobody wants to call themselves orthopedic physician. They say orthopedic surgeon. The glamour, the dignity, and then all that they feel is much more when they tell they are a surgeon than a physician.
So the balance between the technology, new things, and your body's natural healing process and the traditional way of solving problems is the right way to go. If I have to
definitely.
Sum it
balance is the thing. And we are not saying that the technology is wrong. We are not saying that the approach, modern approaches is wrong. They're all very good. They have really revolutionized the way the modern medicine is. And we are very proud of it. Say there is an accident, complex fractures, right? The patient is totally maimed. We put the patient on his feet again with all technologies. There your yoga is not going to come into picture. There your skill, the precision comes.
Yes.
Right? So you do use that there. Patient has got backache. Don't put knife on him. Don't put knife on him.
Yeah.
Do something different. Like
Absolutely.
that. So customize.
Absolutely.
Customize the treatment. According to me, whether you believe it or not, whether you accept it or not, for me, the latest technology is yoga. It's the old wine, in a new bottle. For me, nothing can substitute yoga in the practice of orthopedics.
Wow.
It may seem far-fetched. It may seem too dogmatic, categorical, but I have seen the results with my patients. They are happy. They smile when they go. Yeah. What else you want? The patient is in disbelief. He is not able to understand, comprehend that my solution is so simple. The power, I said, the solution lies with you. Alter your lifestyle. Get up early in the morning. Do 40-45 minutes of exercise. Go, have a peaceful breakfast.
Yeah.
And go to your work and there take breaks. Have ergonomics. Practice ergonomics. Have a proper workstation.
Right.
Work. Come back. Again go for a walk. And drink plenty of water. 2.5 liters of water. And eat your food in time. Eat vegetables, fruits. Avoid junk foods, oil foods, spicy foods. And this salt. All that. Okay? You'll be all right, man. They're trapped in a golden cage. Yeah. They're having a high-paying job. They can't quit the job. They are not ready to accept that the lifestyle has damaged their whole personality. And, they're thinking that doctor will fix it. They come to me, they'll fix it. I said, I can fix if there is an issue. If there is a lifestyle issue, you have to fix, not me. Yeah. So I have got a lifestyle questionnaire. I'll give to the patient, fill that lifestyle questionnaire first. So they'll write what time they get up, how much time they spend with kids, how much time they spend with wives, how much they spend time with family. All nil, they score nil. Then how do you expect that you'll be all right, man? Your backache will not go, sir, what has got backache to do with lifestyle? I said, lot. It's your mind. Your mind is full of, completely clouded. So they don't believe that there can be such easy solution.
No, sir, and I think, this conversation is so enriching. We can just go on and continue. And it's filled with lots of advice, lots of understanding, be it patience, be it the experience that you have. But I would really like to listen to that one advice that you would like to share or give, which is important for a young healthcare professional, maybe in orthopedic space or in any other medicine space. The sort of the advice that you would like to share, which is the gist of many of these things.
One advice I would like to give my youngsters. You are all very intelligent. There is no doubt blessed with a human brain, we cannot comprehend. You people are so intelligent. Right. One thing as a doctor you should have is the empathy for the patients. Right. Put the patient in your parents' place.
Wow.
Put them in your family position. Would you operate on your grandfather, grandmother if there is a knee pain? Will you operate on your mother? Your mother will never allow you to touch her knee if you say you're going to operate on her. Right? You have a different standard when it comes to your family. But when it comes to patients, even a simple complaint, you are right, left, center, you advise surgery. Just put people in the position of your family. If you are not going to do to them, then don't do it for them.
Wow.
That's the only guiding principle you should have.
This was so enlightening and I enjoyed every bit of it. I learned a lot. I am a technocrat, but I learned a lot. And that's what we also call about in technology as well. And all of these AI, the human angle is the most important. So technology is an aid to the doctors, and that is how it should be developed and it should be leveraged. And all of your experiences with patients, it's so enriching. Thank you so much.
Humanize the AI.
Yeah.
Humanize robotics.
Yeah.
Don't become a robotic yourself.
Exactly.
So that's what I would infer from all this. Thank you so much.
Thank you so much, sir.
For giving me this opportunity to express myself. Still a lot of things to tell you some other time.
Sure, absolutely. Would love to have more conversations with you, and
Thank you very much, sir.
Thank you, sir. Thank you so much.